A patient is prescribed warfarin. Which laboratory test should the pharmacy technician know is essential for monitoring therapy? A. Hemoglobin A1C. B. Creatine kinase. C. Blood urea nitrogen, BUN. D. International Normalized Ratio, INR. Answer, D. INR measures the effectiveness of warfarin and ensures patients are within the therapeutic range, minimizing bleeding risk. Pharmacy technicians must recognize this monitoring requirement to counsel patients and flag abnormal values for the pharmacist. Which of the following medications requires a REMS, risk evaluation and mitigation strategy, program due to teratogenicity risk? A. Metformin. B. Isotretinoin. C. Lisinopril. D. Levothyroxine. Answer, B. Isotretinoin can cause severe birth defects. REMS programs ensure patients use contraception, undergo pregnancy testing, and receive education on the risks, which technicians must verify before dispensing. A compounded sterile preparation must be stored at 2 to 8 degrees Celsius. Which of the following actions is correct for the pharmacy technician? A. Leave it on the counter for immediate use. B. Freeze until administration. C. Place it under the laminar flow hood indefinitely. D. Store in a refrigerator with temperature log monitoring. Answer, D. Proper refrigeration is required to maintain sterility and potency. Temperature logs ensure regulatory compliance and patient safety. Leaving at room temperature or freezing could compromise stability. A prescription reads, hydrochlorothiazide 25 mg PQD times 30 days. How many tablets should the pharmacy technician dispense? A. 15. B. 30. C. 60. D. 90. Answer, B. QD times 30 days means 1 tablet per day for 30 days equals 30 tablets total. Correct calculation prevents under or over dispensing and ensures patient safety. A patient reports dizziness after starting a new antihypertensive. Which class of medication is most likely responsible? A. ACE inhibitors. B. Beta blockers. C. Diuretics. D. Calcium channel blockers. Answer, A. ACE inhibitors can cause hypotension, leading to dizziness, especially after the first dose. Technicians should recognize adverse effects and refer patients to the pharmacist for further evaluation. Which medication should never be crushed before administration? A. Levothyroxine. B. Immediate release acetaminophen. C. Extended release metformin. D. Amoxicillin suspension. Answer, C. Crushing extended-release tablets alters absorption, leading to potential toxicity. Technicians must identify medications with special formulations to prevent errors. Which type of prescription requires the pharmacist to verify the prescriber's DA number? A. Schedule III controlled substance. B. Schedule V controlled substance. C. Over-the-counter antihistamine. D. Vitamin D supplement. Answer, A. Schedule IIIV controlled substances require DA verification for legality and safety. Technicians must check DA numbers to prevent diversion and regulatory violations. Which of the following auxiliary labels is appropriate for ciprofloxacin? A. Take with food to avoid stomach upset. B. Avoid direct sunlight, may cause photosensitivity. C. Do not take dairy products at the same time. D. Refrigerate at all times. Answer, C. Ciprofloxacin absorption can be reduced by dairy products. Patients must be counseled to separate administration by at least 2 hours to ensure efficacy. A prescription is written as 0.5 g TID. How many milligrams per dose is required? A. 50 milligrams. B. 500 milligrams. C. 5 milligrams. D. 0.05 g. Answer, B. 0.5 grams equals 500 milligrams. Correct conversion is critical to prevent dosing errors and ensure patient safety. Which of the following is not an appropriate role of a pharmacy technician? A. Counting and labeling medications. B. Managing inventory and restocking. C. Preparing medication for pharmacist verification. D. Conducting patient counseling independently. Answer, D. Technicians can assist with many pharmacy tasks but cannot provide independent counseling, which is the pharmacist's responsibility. This distinction is essential for compliance and safety. Which medication requires light protection to maintain stability? A. Furosemide. B. Nitroglycerin. C. Amoxicillin. D. Atenolol. Answer, B. Nitroglycerin degrades when exposed to light. Technicians must ensure proper storage in opaque containers to preserve potency. Which of the following is the correct way to dispose of expired controlled substances? A. Pour down the sink. B. Place in a sharps container. C. Document using DA Form 41 for destruction. D. Flush immediately. Answer, C. DA Form 41 documents proper destruction of controlled substances. Improper disposal risks environmental contamination and legal consequences. A patient has an allergy to penicillin. Which of the following prescriptions should the technician flag? A. Amoxicillin. B. Azithromycin. C. Metronidazole. D. Ciprofloxacin. Answer, A. Amoxicillin is a penicillin derivative and can trigger allergic reactions. Technicians must recognize allergies and alert the pharmacist before dispensing. What is the main purpose of a hard copy prescription log in a pharmacy? A. Track patient billing history. B. Monitor inventory and prevent diversion. C. Provide medication counseling. D. Schedule pharmacist shifts. Answer, B. Prescription logs help track controlled substances, prevent diversion, and ensure compliance with federal regulations. Technicians are responsible for accurate record keeping. Which medication can cause a disulfiram-like reaction with alcohol? A. Ciprofloxacin. B. Omeprazole. C. Lisinopril. D. Metronidazole. Answer, D. Metronidazole inhibits alcohol metabolism, causing flushing, nausea, and vomiting. Patients should be counseled to avoid alcohol during therapy and 48 hours after. A prescription reads, prednisone 10 mg QOD times 10 doses. How many tablets are required? A. 5. B. 10. C. 15. D. 20. Answer, B. QOD means every other day. 10 doses every other day equals 10 tablets total. Correct interpretation prevents under- or overdosing. Which drug requires a black box warning for risk of tendon rupture? A. Levofloxacin. B. Metformin. C. Hydrochlorothiazide. D. Atenolol. Answer, A. Fluoroquinolones like levofloxacin can cause tendinitis and tendon rupture. Technicians should recognize black box warnings to provide proper counseling and safety checks. A pharmacy technician receives a prescription with an unusual dose outside normal range. What should they do first? A. Dispense as written. B. Ask the patient if the dose seems right. C. Notify the pharmacist for verification. D. Adjust the dose according to guidelines. Answer: C. Technicians must refer any questionable prescriptions to the pharmacist. Adjusting independently is prohibited. Patient verification is not sufficient. Which type of medication error occurs when the wrong strength of a drug is dispensed? A. Omission error. B. Wrong dose error. C. Adverse drug reaction. D. Therapeutic duplication. Answer: B. Dispensing the incorrect strength is a wrong dose error. Technicians must carefully check labels and calculations to prevent harm. Which of the following medications is commonly measured in units rather than milligrams? A. Insulin. B. Acetaminophen. C. Amoxicillin. D. Prednisone. Answer: A. Insulin doses are expressed in units. Technicians must ensure accurate measurement and counseling for patients using syringes or pens. A prescription says, take 1 tablet PO-BID PRN pain. How should the technician interpret this? A. 1 tablet by mouth twice daily as needed for pain. B. 1 tablet by mouth every 2 hours. C. 1 tablet by mouth before bedtime. D. 2 tablets by mouth daily. Answer: A. BID is twice daily, PRN is as needed. Proper interpretation prevents misuse and ensures effective therapy. Which of the following tasks can a pharmacy technician perform under pharmacist supervision? A. Diagnose a patient condition. B. Recommend over-the-counter medications. C. Compound sterile for medications. D. Prescribe refill quantities independently. Answer: C. Compounding sterile medications is a technician role under pharmacist supervision. Diagnosing and prescribing independently is outside their scope. Which of the following is the safest way to handle hazardous chemotherapy drugs? A. Wear gloves and use a biological safety cabinet. B. Handle in open air with gloves. C. Use a regular syringe and cap. D. Store with non-hazardous medications. Answer: A. Chemotherapy drugs require gloves and a biological safety cabinet to prevent exposure and contamination. Proper PPE and equipment are crucial for safety. Which of the following is the correct way to calculate a pediatric dose based on weight? A. Dose equals adult dose times patient weight divided by 150 pounds. B. Dose equals fixed adult dose regardless of weight. C. Dose equals patient age times 5. D. Dose equals patient weight times recommended mg/kg. Answer: D. Pediatric dosing is weight-based using mg/kg. Adult dose scaling or age-based calculation may cause under- or overdosing. A pharmacy technician notices a medication stored past its expiration date. What should they do first? A. Dispense to patient anyway. B. Notify the pharmacist and remove it from stock. C. Attempt to repackage the medication. D. Mark it as for emergency use. Answer: B. Expired medications may lose potency or be unsafe. Technicians must notify the pharmacist and remove the item, maintaining patient safety and regulatory compliance. Which of the following medications is most likely to cause hypokalemia and require monitoring of potassium levels? A. Lisinopril. B. Amoxicillin. C. Metformin. D. Furosemide. Answer: D. Furosemide is a loop diuretic that increases potassium excretion, potentially leading to hypokalemia. Technicians must recognize medications requiring lab monitoring and alert pharmacists of at-risk patients. Which of the following routes bypasses first-pass metabolism entirely? A. Oral. B. Sublingual. C. Rectal. D. Topical. Answer B. Sublingual administration allows direct absorption into systemic circulation, avoiding hepatic first-pass metabolism. Technicians should know route implications for onset and bioavailability. A prescription reads, omeprazole 20 mg PO daily times 90 days. The technician notices the patient has insurance coverage limiting 30-day fills. What is the proper action? A. Dispense 90 days without verification. B. Cancel the prescription. C. Reduce the dose to 10 mg to meet insurance. D. Split into 3 30-day fills and notify the pharmacist. Answer D. Insurance restrictions must be respected. The technician should prepare 30-day fills and inform the pharmacist to verify the plan's policy while maintaining therapy continuity. Which type of error occurs if a patient receives the wrong formulation of a medication? A. Wrong route error. B. Wrong formulation error. C. Therapeutic duplication. D. Omission error. Answer B. Dispensing a medication in an incorrect form, e.g., tablet versus capsule, constitutes a wrong formulation error. Technicians must double-check the prescription against the medication stock. Which of the following medications is commonly dispensed as a sublingual tablet? A. Nitroglycerin. B. Levothyroxine. C. Metformin. D. Omeprazole. Answer A. Nitroglycerin sublingual tablets allow rapid absorption for acute angina episodes. Technicians should know dosage forms for appropriate patient education. A prescription reads, prednisolone 5 mg POQ6H-PRN inflammation times 10 days. How many total doses should be dispensed? A. 20. B. 30. C. 40. D. 60. Answer C. Q6H means 4 times daily. For 10 days, 4 times 10 is equal to 40 doses. Accurate calculation prevents under- or overdosing. Which of the following is a primary function of a pharmacy technician when preparing sterile for medications? A. Diagnosing patient conditions. B. Following a septic technique under supervision. C. Counseling patients independently. D. Prescribing medication quantities. Answer B. Technicians prepare sterile IVs using a septic technique under pharmacist supervision. Diagnosing and prescribing are beyond their scope. Which auxiliary label is appropriate for a prescription of doxycycline? A. Avoid alcohol. B. Take with full glass of water and remain upright to prevent esophageal irritation. C. Refrigerate at all times. D. May cause drowsiness. Answer B. Doxycycline can irritate the esophagus and cause ulcers. Patients should be counseled to swallow with water and remain upright for at least 30 minutes. Which of the following medications requires counting trays that are not used for other drugs to prevent cross-contamination? A. Nitroglycerin sublingual tablets. B. Hydrochlorothiazide tablets. C. Loratadine tablets. D. Acetaminophen tablets. Answer A. Nitroglycerin tablets are sensitive to moisture and contamination. Dedicated trays prevent degradation and ensure potency. Which medication is commonly measured in milliequivalents, milliequivalent, instead of milligrams? A. Amoxicillin. B. Acetaminophen. C. Potassium chloride. D. Ibuprofen. Answer C. Electrolytes like potassium are measured in milliequivalent to reflect the ionic concentration accurately. Proper dosing is critical for safety. Which of the following is considered a high-alert medication in pharmacy practice? A. Warfarin. B. Loratadine. C. Calcium carbonate. D. Omeprazole. Answer A. High-alert medications like warfarin carry a high risk of causing significant harm if used incorrectly. Technicians must take extra precautions in labeling and verification. Which DA schedule includes medications with a high potential for abuse but accepted medical use? A. Schedule 1. B. Schedule 2. C. Schedule 4. D. Schedule 5. Answer B. Schedule 2 drugs, such as morphine, have high abuse potential but legitimate medical use. Technicians must verify prescription and ensure proper documentation. A patient brings a prescription for insulin glargine pens. What storage instruction should the technician provide? A. Keep at room temperature before use, refrigerate unused pens. B. Freeze all pens. C. Store in direct sunlight. D. Shake vigorously before use. Answer A. Insulin pens may be kept at room temperature for use but must be refrigerated before first use. Freezing or sunlight exposure compromises potency. Which of the following medications requires routine INR monitoring? A. Apixaban. B. Warfarin. C. Heparin. D. Clopidogrel. Answer B. Warfarin requires regular INR checks to maintain therapeutic anticoagulation. Apixaban and others do not require routine INR monitoring. Which of the following medications should not be taken with grapefruit juice? A. Simvastatin. B. Metformin. C. Levothyroxine. D. Amoxicillin. Answer A. Grapefruit juice inhibits CYP3A4, increasing simvastatin levels and risk of myopathy. Technicians should counsel patients on dietary interactions. A prescription reads azathioprine 50 mg PO daily times 60 days. Which of the following is the technician's responsibility? A. Monitor complete blood counts. B. Ensure correct quantity is dispensed. C. Adjust dose based on patient labs. D. Diagnose patient condition. Answer B. Technicians ensure the correct quantity is dispensed and labeled. Monitoring labs or adjusting doses is the pharmacist or prescriber's role. Which of the following is true regarding unit dose packaging? A. Reduces medication errors and ensures accuracy. B. Increases the risk of contamination. C. Is only used for 4 solutions. D. Does not require pharmacist verification. Answer A. Unit dose packaging reduces errors by pre-counting and labeling individual doses. It is widely used in hospitals for safety and inventory control. A patient calls asking for clarification on OTC ibuprofen dosing for a child. What should the technician do? A. Provide exact dosing instructions over the phone. B. Advise consulting the pharmacist or healthcare provider. C. Recommend an adult dose. D. Suggest multiple doses at once to prevent pain. Answer B. Technicians cannot provide independent dosing instructions. They must refer the patient to the pharmacist to ensure safety. Which of the following is an appropriate technique for counting tablets in a pharmacy? A. Use a counting tray and spatula. B. Count directly in hand. C. Pour tablets into prescription bottle and guess the quantity. D. Shake tablets in the bottle and pour. Answer A. Counting trays and spatulas reduce contamination and errors. Direct handling or estimating is unsafe and non-compliant. Which medication requires special handling due to potential teratogenic effects? A. Metformin. B. Acetaminophen. C. Atenolol. D. Methotrexate. Answer D. Methotrexate is highly teratogenic. Technicians must follow safety guidelines, wear PP, and avoid exposure to pregnant staff or patients. A prescription reads, morphine sulfate 15 mg POQ4-HPRN times 7 days. How many doses will be dispensed? A. 28. B. 30. C. 42. D. 56. Answer A. 24 hours divided by 4 hours equals 6 doses/day times 7 days equals 42 doses. Correct calculation prevents under or overdosing. Technicians must double-check math. Which of the following is a primary role of pharmacy technicians in a hospital setting? A. Prescribing medications. B. Preparing foreign mixtures under supervision. C. Diagnosing illnesses. D. Counseling patients independently. Answer B. Technicians assist with sterile compounding and preparation of 4 medications under pharmacist supervision. Prescribing and diagnosing are outside their scope. Which drug interaction is most concerning with warfarin therapy? A. Ibuprofen increasing bleeding risk. B. Vitamin C enhancing effect. C. Acetaminophen neutral effect. D. Lisinopril neutral effect. Answer A. NSAIDs like ibuprofen increase bleeding risk in warfarin patients. Technicians must identify potential interactions and alert pharmacists. Which medication requires monitoring of blood glucose in diabetic patients? A. Loratadine. B. Lisinopril. C. Furosemide. D. Metformin. Answer D. Metformin is used to control blood glucose. While not directly dangerous, technicians must recognize medications requiring patient education and monitoring. Which of the following medications requires patient counseling about potential photosensitivity? A. Doxycycline. B. Loratadine. C. Metformin. D. Levothyroxine. Answer A. Doxycycline can make skin more sensitive to sunlight. Patients should be advised to use sun protection to avoid sunburn or rash. A patient is prescribed clopidogrel after a recent stent placement. Which counseling point is most important? A. Avoid NSAIDs to reduce bleeding risk. B. Take with dairy to increase absorption. C. Skip doses on weekends. D. Refrigerate capsules. Answer A. Clopidogrel is an antiplatelet agent. Combining it with NSAIDs increases bleeding risk. Technicians should recognize interactions and reinforce pharmacist counseling. Which of the following is required on the label of a dispensed controlled substance? A. Patient initials. B. DEA number of prescriber. C. Date of birth of technician. D. Medication lot number. Answer B. Controlled substance labels must include the prescriber's DEA number for legal verification. Other information may be included for safety but is not federally required. Which oral dosage form allows rapid disintegration without water? A. Effervescent tablet. B. Sublingual tablet. C. Chewable tablet. D. Orally disintegrating tablet, ODT. Answer D. Orally disintegrating tablets dissolve quickly in the mouth without water, improving compliance for patients with swallowing difficulties. Which medication is commonly dispensed in a unit-of-use blister pack in hospitals? A. Warfarin. B. Metoprolol. C. Amoxicillin. D. Acetaminophen. Answer B. Unit-of-use blister packs ensure accurate daily dosing and reduce medication errors in inpatient settings. Which of the following medications may cause tendinitis and should be counseled accordingly? A. Ciprofloxacin. B. Levothyroxine. C. Hydrochlorothiazide. D. Simvastatin. Answer A. Fluoroquinolones like ciprofloxacin have black box warnings for tendinitis and tendon rupture. Technicians should ensure patients understand potential side effects. A prescription reads, hydrocodone 5 mg per acetaminophen 325 mg POQ4 6-HPRN times 7 days. How should the technician advise regarding maximum daily acetaminophen? A. 3,000 mg per day. B. 4,000 mg per day. C. 5,000 mg per day. D. 1,500 mg per day. Answer B. Maximum acetaminophen is 4,000 mg per day to prevent liver toxicity. Technicians must counsel patients on safe dosing limits, especially when combination products are used. Which auxiliary label should be placed on a prescription for levothyroxine? A. Take with food. B. Avoid sunlight. C. Refrigerate after opening. D. Take on an empty stomach. Answer D. Levothyroxine should be taken on an empty stomach to ensure consistent absorption. Technicians should educate patients to improve therapeutic efficacy. Which of the following is the most accurate way to measure liquid medications for pediatric patients? A. Household spoon. B. Oral syringe. C. Measuring cup with estimates. D. Dropper without markings. Answer B. Oral syringes provide precise dosing and minimize errors. Household spoons and unmarked droppers are inaccurate and unsafe for children. Which medication requires monitoring for ototoxicity? A. Vancomycin. B. Acetaminophen. C. Metformin. D. Omeprazole. Answer A. Vancomycin can cause hearing damage at high doses or prolonged therapy. Technicians should flag patients for pharmacist counseling on monitoring. Which type of compounding requires the use of a laminar airflow hood? A. Non-sterile creams. B. Sterile 4 medications. C. Tablet splitting. D. Counting tablets. Answer B. Sterile compounding requires a laminar airflow hood to maintain aseptic technique and prevent contamination.